Hey everyone, this is Jeff Young, kinesiologist, and this is PowerPoint presentation number 3 in a series of about 10 presentations that I created on medical fitness. This one is on general sports medicine concepts and guidelines. The next 2 are on exercise science concepts and guidelines, and even though I separated them into 3 presentations, the truth is they all go together, so it would be really beneficial if you watch all 3 because it would help give clarity to the overall picture that I'm trying to paint. This one is only about 8 slides in length, so I'll go ahead and get started. So we'll start with factors or mechanisms associated with and increase the risk of injury. This is just a short list of examples. It is not a comprehensive list. The first one is improper form is associated with and increases the risk of injury, especially under moderate to heavy load or under condition of fatigue. Insufficient warm-up, especially prior to an explosive movement or a maximum effort event. Repetitive stress, movement restrictions, or in other words, areas of tightness, and lack of stability under a load, especially when the tissue is on stretch. So these are all examples of mechanisms that are associated with and increase the risk of injury. There's only one cause of injury, and the cause of injury is that in the moment of time that the injury occurred, the injured tissue, such as bone, secondary soft tissue like tendons and ligaments, or the muscle, wasn't able to, or lacked the capacity and wasn't able to tolerate the load, force, or stress that was placed upon it. And the point is that while I don't want to make light of the importance of a proper graded warm-up, proper form, improving mobility and stability where needed, because they are important components of injury prevention and rehabilitation. And while it's true that those can be performed using low-intensity therapeutic exercises and approaches such as Airex pads, Bosu balls, body weight exercises, TheraBands, and things like that, ultimately what we need to do is increase the tissue's capacity to tolerate various loads, forces, and stresses, as well as fatigue, and this is accomplished through a strength and conditioning program that includes progressive overload. So now I'll explain another important and related concept, the 5 primary components of a healthy musculoskeletal system. First, I'll list them, I'll give them some clarity, and then I'll break it down even further in the next few slides to make it simpler or easier to understand, especially as it relates to this presentation as a whole. One component of a healthy musculoskeletal system is neuromuscular control, otherwise known as motor control. And all that really means, very simply defined, is that in any movement, no matter what the movement is and no matter how simple or complex, that the right muscles are producing the right force at the right time. And we can break that down further and say that the prime movers are doing the primary work, the assisters are assisting, and the stabilizers are stabilizing, but motor control always manifests itself in the form of proper form. So obviously, if we have proper form, the right muscles are producing the right force at the right time, which means that motor control and proper form mean the exact same thing. Another component of a healthy musculoskeletal system is strength. The weaker we are, the more at risk we are for injury, joint pain, or other musculoskeletal issues. But since force is a subcomponent of motor control, and the stronger we are, the more force our muscles can produce, strength is not only a component of a healthy musculoskeletal system in and of itself, but it's also a subcomponent of motor control. So for example, if someone lacks motor control and therefore has improper form, we want to show them what they're doing wrong, use verbal, tactile, and visual cues to show them how to do it right, have them practice it over and over, and strengthen them in the movement over the course of time as a major way to improve motor control. So strength is really closely related to motor control. Joint stability is another component of a healthy musculoskeletal system. When we can't improve stability without strengthening, or more specifically, create balance strength around each major joint. So strength, or more specifically balance strength, is a major component of joint stability as well. Posture and alignment is another component of a healthy musculoskeletal system, and so is mobility, which we also want to balance around each joint. And if we balance mobility and we balance strength around each major joint, then we will move in the right direction many postural or alignment issues, depending on what the issue is. And in some cases, we can even completely self-correct. So the point of this slide is that strength, or more specifically balance strength, is a major component of 4 out of the 5 components of a healthy musculoskeletal system. And what is left over is mobility, which we also want to balance around each major joint. This slide, I just give mobility a little bit more clarity. There are 3 subcomponents to mobility. One is flexibility, or in other words, joint range of motion. I put trigger point release, or in other words, self-myofascial release, as a subcomponent of flexibility, even though it does more things than just improve flexibility. Since it does improve flexibility, that's the reason why I put it as a subcomponent of flexibility and therefore more mobility. And then joint capsules, such as your ankle capsule, your hip capsule, and your shoulder capsule, can either be normal, tight, or loose. So flexibility and mobility, a lot of people think they mean the exact same thing. They are definitely closely related, but there is a difference. And these next bullet points, I just very quickly explain or give some clarity as to what the difference is. Mobility is where strength and flexibility intersect. So flexibility is the ability to move a joint through its full range of motion. That's the definition of flexibility. And mobility is the usable range of motion in dynamic loaded conditions. So that's where strength comes in, loaded conditions. And that is the difference between flexibility and mobility. So what this all really means and what it comes down to is that it literally doesn't matter what the condition is or where it is, whether it's spine, shoulder, hip, knee, low back. It really honestly doesn't matter. The approach needs to, at least the foundation of the approach, is the same for all of the above. Where you're tight, get immobile, or where they're tight, get immobile, because that's how you balance mobility. Where they're weak or hypermobile, get them strong, because that's how we balance strength around each joint. Try to get them out of a beginner range of strength, because most people fall in the beginner range of strength, and really that's just going to be the function of a proper strengthening program, because a proper program includes progressively overloading the person and getting them stronger over the course of time, and ensure proper form. So if we do those things, balance mobility, balance strength, put them on a proper progressive strengthening program, and ensure proper form, that's what sets the foundation for everyone, no matter what the condition is, no matter where it is, because balancing mobility is going to remove movement restrictions. Balancing strength around each major joint and getting them stronger is going to create joint stability. Obviously, it's going to improve strength because you're progressively getting them stronger. And then ensuring proper form is going to improve motor control. And those are the components of a healthy musculoskeletal system. So now comparing that with physical therapy, just to give it some more clarity, there are 4 main stages of physical therapy or phases, and that you don't necessarily have to complete one phase before you move on to the next. These can absolutely overlap. The first phase is if swelling, inflammation exists. Obviously, pain exists because that's the reason why you're in physical therapy. But if swelling and inflammation also exist, then phase 1 is going to be to use things like ice and electric stimulation and ultrasound, things like that, and also just time healing the wound to reduce the swelling and inflammation. And they also want to early on restore mobility because there's an injury, there's pain, the joint has shut down, and because of that, there's going to be a lack of mobility at the injured joint or joint. So that's the first thing that they tackle. And then next is they're going to find a safe baseline regarding the initial load and the choice of exercise. And typically the emphasis is placed on isolated strengthening, such as your rotator cuff, balance exercises, core strengthening, things like that, and gait training if it's applicable. And then the last stage, as long as insurance hasn't kicked you out by then, is they're going to move to more functional strengthening and more of the kinetic chain. And they'll continue on with balance or gait if applicable. But the main point of this slide is that, first of all, in post-rehab, the swelling or inflammation has either gone away or is nearly gone. And so that really doesn't apply in a post-rehab situation. And where they're tight, get them mobile, and where they're weak, get them strong. So all I'm really doing is taking the general theme or approach that is used in physical therapy and applying it to the entire body. So I use the last slide as a way to show similarities between physical therapy and how I go about designing programs for post-rehab and medical fitness. In this last slide, I'm going to show a couple differences between physical therapy and medical fitness. This is from an APTA definition, American Physical Therapy Association. I totally would admit that it's very general. It does not apply in every situation. But generally speaking, physical therapy typically seeks to reduce, manage, or negate pain, restore function, and improve activities of daily living. Now, once again, the population in this video and really all my videos is the general population and not athletes. So this applies to physical therapy for much of the general population, but there are definitely outliers. And a major difference, and the reason why I highlighted this in red, is that medical fitness, and because we have more time to spend with the patient, typically speaking, and can train and strengthen the whole body rather than insurance dictating not only how long or short they're in therapy, but also insurance dictates what parts of the body you can rehabilitate, whereas with medical fitness, we're strengthening every major muscle group in the body. So what we do is a form of exercise, and the definition of exercise is that it is planned, structured, repetitive, and purposeful, and employed for improving or maintaining optimal levels of physical fitness and function. And many times you're just not able to do this in physical therapy. Once again, I'm not blaming physical therapists. I actually blame more the insurance and just how the system is kind of set up. But the point of this slide is that these are major differences, or can be major differences, between physical therapy and medical fitness. So that wraps up this video. And like I said early on, the next couple videos are concepts and guidelines for exercise science, and they're very closely related to this video. I build on this and explain how I go about designing programs. So I hope you'll take the time to watch them, and please comment below if you have any questions or comments. And I want to thank you for watching, and I'll see you in the next video.